Good afternoon, everyone. We are live from Sakra World Hospital, Bangalore. Today we have Dr. Narender, the senior consultant from plastic surgery, who will be talking on liposuction and some of the myths associated with liposuction. Welcome to the program, sir.
Good afternoon.
Good afternoon. So, some questions. What is liposuction and what is the benefit of liposuction?
Liposuction is a surgical procedure through which unwanted fat in the body is reduced. Now, it is typically done by making small hidden incisions, usually around 4 to 5 millimeters, just 2 or 3, or like on the abdomen. And through that, a straw-like instrument is introduced, and it's connected to a motor that sucks. And through that, we suction out fat and reduce the level of fat from areas where we don't want fat, like in the abdomen, thighs, tummy, arms. So this is the process of liposuction.
Okay.
Now, like I said, it helps us to reduce the unwanted fat that's there in various parts of the body. That is the main use of it. That helps us to get a better body contour, better shape, and especially people who have been struggling to lose weight, to get that desired shape
to
that
look
they
good.
want. To look good, to look better.
Better, yeah.
Right. So that's where liposuction comes in.
Okay. And what is benefits, like how it's going to benefit someone who undergoes this?
So the main benefits of liposuction are to help a person achieve a better body shape, right? To look slimmer, trimmer, and that in turn will have its own psychological benefits, and they're able to have a better lifestyle thereafter. More they're able to maintain that with greater commitment. Once they see that there's a good improvement in their body shape, then they will be very conscious about indulging in eating unnecessarily, or maintaining diets will be much easier.
Correct. It will also increase their confidence level.
Very much so.
Yeah?
That is the main reason.
Correct.
How it helps.
Okay. How is it different from tummy tuck?
So in tummy tuck is a separate procedure altogether. In tummy tuck, also known technically as abdominoplasty, what is done is that excess skin and fat from the abdomen is removed altogether through a concealed lower incision, and also the muscles that are there in the abdominal wall, they are tightened. So that helps to make the abdominal tummy, the tummy itself, smooth, flat, and we also reposition the umbilicus. So that is the procedure of tummy tuck. In tummy tuck, quite often we include liposuction to remove only the additional fat in that part of the tummy skin which we are going to preserve. So in that we can include liposuction over there. So liposuction is just sucking fat out from areas where it is excess.
Okay, so does lipo has a meaning of fat or something?
Yes, lipo refers to fat. Suction, as the term says, is sucking it out. So that's what it means.
Yeah, that's very clear actually. So is there any risk involved in this procedure?
So in reality, liposuction is a very safe procedure. So why we say that is that when we do liposuction, we are actually operating immediately below the skin. And in this plane, there are no critical structures, no major organs, nerves, blood vessels. So as long as we follow the safety protocol recommended, liposuction is extremely safe. There is minimal to no risk at all. It is a safe procedure. It's only when those risks when the guidelines are not followed strictly, that people end up with issues.
Okay. So is it a weight loss procedure, liposuction?
So no, liposuction is not a weight loss procedure. The reason we say that is, if suppose somebody has body weight of 130 kgs, 140 kgs, liposuction is not for them. Because for them, bariatric surgery or weight loss surgery, that is an entirely different thing. Liposuction is for the others who have more or less achieved their body weight, ideal body weight, but are not able to get the shape they want. And they are the best candidates for liposuction.
So can you do liposuction for any part of your body?
That is correct. Liposuction can be done for any region where you feel that there is an excess fat and you want to reduce it. Liposuction can be done.
So what do you do with this fat? What do you remove?
Depending, so we have a detailed discussion first with the patient, and if the patient expresses that they would like, if suppose we have women who would like to have a natural breast augmentation kind of thing, so in that situation, the excess fat which is suctioned out is filtered, centrifuged, and then it is re-injected back into the breast to give a natural breast augmentation.
Okay. On the same patient?
On the same patient, yes. The same, their own fat can be re-injected into areas where they would like to have more fat.
Okay.
Commonly, people would like to have like a breast augmentation, or some women would even prefer to have buttock augmentation. So these can be done with a fat that has been liposuction.
So do they do it on the same sitting?
Yes, it can be done in the very same sitting.
Same sitting,
Yes.
okay. Okay, and does breast reduction comes under the same procedure?
So breast reduction is again a completely different procedure, and it has a different set of indications. For breast reduction, as part of breast reduction, often women express their interest to have liposuction of the abdomen. So that time we combine liposuction along with the breast reduction procedure.
Okay. And there is a myth, or there is a common saying that the liposuction or the result of liposuction depends on the technology. Technology plays a very important role here. Do you believe in that as a clinician?
So what we have seen is that we have used various kinds of instruments and various types of equipment. The ultimate result really depends upon the expertise and skill of the operating surgeon and on the diligence of the patient, how careful they are to follow a post-operative protocol, how carefully they stick to a diet, how carefully they stick to a weight loss regimen, how they use pressure garments. So these all factors determine the final outcome.
Okay.
Technology is not really that much of importance.
Basically, it's the skill and experts, right?
Yes.
So also there is a saying, or people think that only a celebrity or a media person is supposed to undergo this. What about the normal people?
So that's really a myth. The liposuction is actually, it's not only for those people, celebrities and media persons. We understand, they're always in the public eye and they have to, they pay a lot of attention to their own body shape and figure. But then this is a procedure which is open to all.
Okay.
And as societies on the whole, the perceptions of society are changing. People are becoming more self-conscious, and we get requests from youngsters who now want to look, their best.
Yeah.
And through a simple, safe procedure, we help them there.
Okay. So, is there any category of people who cannot undergo liposuction, or do you have restrictions before you do surgery?
Sure. So we, before we subject anyone to liposuction, we first ensure that they have realistic expectations of the procedure.
Okay.
Then we also ensure that they already are following either some sort of an exercise regimen or some sort of a diet program, and they're not having major weight fluctuations. That's very important to make sure they have a steady weight. Then only we would do a liposuction. If somebody came in with a body weight of 120 kgs or something, we would not subject them to liposuction. We would refer them to a bariatric surgery.
Correct. And what are the side effects, and is it a short-term effect or a long-term effect, and what are the chances of recurrence?
So liposuction per se is a really safe surgery, and it doesn't have any significant side effects.
Okay.
Because all we are doing is removing excess body fat. That's all, and through hidden concealed incisions. So it doesn't have any side effects as such.
Okay.
The risks that we discuss with the patients before we do liposuction is that sometimes some areas there can be a minor contour changes. Like some areas there can be some mild dimpling, mild puckering of skin, some minor changes like that. But they are all transient, and eventually they will even out with time. Apart from that, it is really safe.
Okay.
Now, how long results will last really depends upon the patient.
Okay.
How well they take care of themselves. If they follow a strict dietary regimen and they maintain a good exercise schedule, subsequent to procedure, these results can maintain for a very long time.
Okay. So my next question was that, for a better longevity, what all one person should follow in terms of their lifestyle, food habits, exercise, and other general well-being. So I think you answered to that. So with that, I think takes care of most of the questions. But I have one question. In your experience, what is the age group, who approaches you for this procedure?
So we get a peak of requests. I mean, the commonest age group we see where this happens is in the 30 to 35-year-olds. They are the commonest that we see.
Okay.
Some of them are like busy professionals who are unable to dedicate an hour a day or more to the gym, or have already done
to
that.
burn out there.
Correct.
Okay.
Have done that, but have not been able to get rid of stubborn fat from the flanks, thighs. These areas, we call them like stubborn fat areas. Despite all their workouts, despite the dietary exercise, dietary schedules and regimens, it's sometimes difficult to burn these last few calories. So they are the ideal candidates for this.
But do you recommend for older people like 50 plus?
Oh, very much.
Okay.
So there is really no age restriction at all for this, because it is a safe procedure.
Correct.
And provided the general health of the patient is good, it can be done for anyone at any age, as long as the understanding is that subsequently they are going to be able to maintain a good exercise regimen and a good dietary regimen. It's definitely likely to give benefits.
Even though the person is diabetic, hypertensive and all that.
So even in those situations, provided the risks are understood, and we've got the sugars under control, the hypertension is under well controlled.
Like for any other surgery?
It's like for any other surgery. It's in fact little less than any other surgery, because again, the major risks are not there in this procedure, because we're only dealing with fatty tissues, and as such, it's not the element of risk is much
lesser. Okay. I think that takes care of most of the questions, Doctor. Thank you so much. Thank you, viewers. So this is Dr. Narendra and Ajita from Sakra. I hope these questions and answers have helped you a lot, and any more queries, please put it in the comment box. Our experts will get back to you. Thank you so much.
Thank you.